Okay, here's chapter 10, the tissue response to injury. First, let's go over the healing process. And I discussed this in class, the 3 different phases to healing. It's definitely essential for the athletic trainer to possess that knowledge of the healing process. That way, we're able to progress in a rehab in a safe manner without causing more injury to our patient. We went over the use of the cardinal signs of inflammation: the redness, swelling, heat, pain, loss of function. Okay. So for the 3 phases, remember I drew this on the board for you. The inflammatory phase, the fibroblastic repair phase, and the maturation remodeling phase that can last up to 2 to 3 years. So I left that on the PowerPoint for you guys. This breaks down more of the inflammatory response phase. I have it listed out for you to review, but we already went over it in class. This nice little map breakdown that shows you the timeline, basically. So you have injury to the cell, and then it breaks down the chemicals are released, what happens vascularly, and all the way down to the clot formation. And this is within minutes of the injury happening. So here's a picture. Remember I mentioned in class I'll leave up some pictures to show you. So we have a picture of the skin, just like your anatomy drawing. And it goes over and shows the wound here on your left. And then it shows how it's starting to form that blood clot, okay? Then you have phase 2, the fibroblastic repair phase. Again, this is just left up here for you guys to review on the actual PowerPoint. And then the other picture of the blood clot forming. So if you look at the last one, see through the phases, blood clots forming. Then this shows more of the granulation of the tissue, the regrowth of the blood vessels, and how it's repairing what the injury was. This goes over the scar formation. Okay. There's a lot of information on here. I just left it on there for you guys to review. None of those will actually be on the test for you. So then the phase 3, the whole remodeling phase, and this is the one that's that long-term process. Okay. Talked about how we work out and start stretching and strengthening to realign that collagen fiber that's being laid down, right? Because it lays down in such a messy formation that we want to be able to realign it, so that way the tissue can function properly. So this is really what we focus on during this phase. And then this is another picture of the skin, how it shows it's starting to lay it down, and starting to fill in the injury site, and then you have that little scab on the top, right? So see how far down that scar tissue is? Remember, this is skin, so it's actually very thin. But that's why we start working out and trying to smooth out those collagen fibers. Okay, this is the role of progressive mobilization. Initially, when somebody's injured, we want to immobilize them. Okay, so that way it allows for that initial healing process. We want there to be the swelling to come to bring all the healthy cells to start remodeling and fixing the injured site. But it's important right after the initial injury, and if it's safe for movement, to go ahead and start moving, because we need to regain that normal flexibility and strength. And in this time too, we can also issue them protective bracing, so we can still protect the site. If we can allow movement, then we'll allow the movement. If we can't, like if it's a broken bone, and then we'll definitely restrict that motion. During the remodeling phase, we really need to make sure we establish the range of motion, and we need to keep working on that strength, try to get it back to 100%. That's our end goal, right? And then so as we go through, and we're going to help, by doing that, help that remodeling phase and help realign those tissues. Down at the bottom it says must be aware of pain and other clinical signs. Maybe too much too soon. We talked about like the hamstring strain. We're 5 weeks out. It's feeling pretty good, so we try a full run. And when there's actually still a little bit of pain associated with it, he ends up re-tearing it, and then we have to start all over again. So we definitely need to pay attention to these signs, and this is something we express to the athlete to be able to let us know. That's where communication comes into play. Okay, factors that impede healing. We went over some of these, but edema, so swelling, separation of tissue, muscle spasms, the atrophy. That's when a regular muscle looks smaller, right? Because it's losing size. That's atrophy. Infections, we talk about health, age, nutrition. Okay, and now I'm going to start breaking down the different healing processes. So this is the soft tissue healing. Just go on here and review this. The next picture I'm going to show you is actually the cell structure. If you guys remember this, like in biology class or something. Okay, so you have your cell, you have your nucleus, and it goes through and just kind of refreshes you on the different components of a cell. Let me go over the different types of tissues of the body. Okay, bone, it's not classified as a soft tissue. It's a hard substance, right? So it is a live tissue, but it's not a soft tissue. So the 4 different types of soft tissue, as we see throughout here, the ones that we really talk about is the muscle tissue, the skeletal. That's what makes your limbs and stuff work and move. Smooth muscle and then cardiac muscle. Don't worry about these two. These two work without you thinking about it. Hopefully cardiac, right? That's your heart muscle. Smooth muscle, those are your organs. But skeletal muscle, those are the ones that we see on the outside, right? Our biceps or quads, hamstrings. Okay. So through here, I left on some definitions for you guys. Like we talked about atrophy, okay, just decreasing the size of the tissue. And then we talked about hypertrophy. That's just for you guys to review. And then we break down the cartilage healing we talked about in class. So I went ahead and laid that out there for you, along with the ligament healing and the time frames down here at the bottom, and different factors affecting healing. Okay, so this is just for the review, so I won't go over this too much, but tendon healing, nerve healing. Okay, so modifying soft tissue healing. This is also talks about the older patients or those with a poor diet may take longer to heal. That's why it's important if you ever do get injured. Eat very well, very healthy, drink a lot of fluids, exercise still. The more in shape you are, the faster you heal. Okay, I left this on here because this is something that I know we do at Sierra Pacific Orthopedic Center a lot with our athletes. They call it PRP, which we call them ACP injections. They're platelet-rich plasma. So what they do, they draw your blood out, and they spin it, and they get the platelets in your blood, and then they re-inject those platelets into the area that you need to get fixed. So like patellar tendonitis, since we've talked a lot about that. You get patellar tendonitis, well, they'll take this, instead of injecting steroids, they'll inject your own platelets. So your own plasma, they'll take and inject that into the site to help bring healing. And it's had a lot of good success, especially with our athletes. That way we're not injecting steroids, we're injecting their own plasma that helps promote healing on those injured tissues that may have that low blood supply. That's something for you guys to, I find it interesting, and I find it good information, especially if one of you gets hurt, to know that you may have this option to help you. Okay, bone healing. I left a picture on. I know in one of my classes I tried drawing this on the board. It looks much better in this picture, right? So it goes over through the healing process of a bone, how it's formed. Talked about indicators of pain. Pain's different for everyone. So what could be out of a 1 to 10 scale of pain? a 5 on somebody could be a 2 on someone else, or it could be an 8 on someone else. There's a lot of factors that involve that. So you have anatomical structures, so your body, physiological reactions, psychological, social, cultural. Maybe you've never felt pain before and you sprained your ankle and you think it's the end of the world. So everyone's a little different on pain. These are different pain categories. Depending on the pain source, there's fast pain versus slow pain, acute versus a chronic aching pain, and you have projected or referred pain. Referred pain's like if the injury's in one location, but it's shooting pain to somewhere else, that shooting pain is that referred pain. This is the breakdown of them. Don't worry about the different types of fiber, but I did leave it on just for you guys to read over, start getting a little familiar with. And I know we talked about this in the gait theory. So just review this part here. Again, referred pain. Don't worry about the A alpha fibers actually knowing the name, but do review it in case you have it in the class that's later. So our pain control, we talked about that gait theory, right? So I actually have it written out here for you, and I left the actual name of the fibers, the nerve fibers, for you. Just know the basic concept of it. And here's one of the pictures I left up on here of the dorsal horn. You have anterior, which is the front of you, the posterior, the back of you. It's pretty intense looking if you don't know what you're looking at. But just review how the gait theory works. Basically, we use a stimulus to block that gait that overrides that pain, right? See right here? So other than that, that is chapter 10.